Hello everyone, I am Nikhil. Today I have to go to explain the course about the big data analytics. In that, we have to use the big data analytics in the medicine and healthcare. The healthcare industries that are undergoing the transformation driven from the massive influx of the data from the various sources. The big data analytics is a revolutionizing how the diagnose, treat, and manage the health that can be a way to personalize the medicines and improvement of the health outcomes. Let's move on to the introduction to the big data in healthcare. It contains the volumes, varieties, and the velocities. And the first we have moved to the volume. The amount of the data that can be generated by the healthcare systems and the patients records and the medical imaging and the genomic data. And the next one is a variety. The healthcare data that can be comes in the various formats such as structured electronic healthcare and the unstructured medical images and the sensor data from the variables. And the next one is the velocity. The data can be generated and updated continuously. That can be requires the memory and their processing and analyzing the information from the decision making. Let's move on to the data sources in the healthcare from the electronic health records and to the variables. The next one is electronic health records. It's a comprehensive patent information that can be structured and standardized data that can be enabling the longitudinal tracking and their analysis. The next one is the medical imaging, based on the X-rays and CT scans and MRIs, ultrasonic sounds, the high resolution images for diagnosis, and it requires the advantages imaging processing techniques. The next one is wearable sensors. It can be helpful to track the vital signs and activity levels and their sleep patterns. It can be captured the personalized insights also. It can be remoting the monitoring to preventing the cares. And the next one is a genomic data, and it can be used for the individual genetic makeup for and their predispositional to diseases. And the next one is the data sources in the healthcare. And the next one is the opportunities for the big data analytics. It contains the personalized medicines and improved the diagnosis and efficient sources allocations and enhanced the patient engagements. Um, First, move on to the personalized medicines. It can be tailored in the treatment that can be placed based on the individual patient's characteristics like genetics, lifestyles, and their medical history. The next one is the improvement in the diagnosis. The early detection of the diseases by the analyzing the pattern in the patient data. It can be potentially leads to the better outcomes. The next one is the efficient resources allocation. It can be optimizing the resource allocation by preventing that the patent needs to the optimizing the workflows. And the next one is the enhanced the patient engagement. The improving the patient engagement and their adherence to treat the plans and through a personalized communications and their support. The next one is improving the diagnosis and their treatment outcomes. The early disease detection. In earlier, it can be analyzed the patient data sets can be reveal and they can be early signs of diseases. It can be enabling the timely investigations. And the next one is the personalized treatment plans. The big data it can be helps to treat the personalized treatments based on their patient unique genetic and their makeup and their medical histories. The next one is a predictive analytics. In predictive models, it can be forecast the potential health risk and there are recommend their preventional measurements. The next one is the improved the drug development. The data analysis that helps to identify the potential drug in the clinic trials. The next one is a enhanced the population health and management, and it contain four types of their management systems. In first one is identify the health risk. The next one is optimizing the resource allocation, and the next one is promote the preventive care, and the next one is improve the health outcomes. In this, the big data it can be helps to identify the high risk populations and their target in interventions. In the data-driven insights from the it can be enforce the resource allocations for the public health in the activities. It can predict the models helps to the identify the individuals to risk their promote by preventing their measurements. And finally, the data analytics analysis that can be facilitates the development of the efficient public health strategies. And the next one is accelerating the drug discovery and development. And the first one is the targeting the identifications. And then the next, the clinical trial, the designs, and the drug repurposing. Let's move on to the challenges in the leveraging the big data in healthcare. It can be mainly concentrated on the data quality and data silence and their data security and privacy and the lack of standardization. It can be limited the data analytics and expertise and the healthcare system that can be often the separate operating in isolations that can make it difficult to integrate and analyze the data from the various sources. The next one is the ethical and the privacy consideration. In that we have to contain the four types. First one is the data security and the informed consent and the algorithm bias and the data anonymization. It can be it helps to the protecting the sensitive patient data from the unauthorized access with and breaches is crucial. Then the case studies of these success stories in the big data healthcare is it can predict if the modeling of the heart failures. In using the patient data, the hospital can predict their potential of heart failures and their events early reducing the readmissions. The next one is a personalized cancer treatment, and it can be big data can be helps to the personalize the cancer treatment that can be plans based on the geometric data that leads to best outcomes. The next one is the drug discovery that can be through the machine learning. So thank you for watching this video.